Hi and welcome back to my channel. I am so excited for today's video. It has been in the works for so long and I'm so excited that I found a format to do today's topic. So any questions that any of you have, please put them in the comments down below and I will do my best to answer any of your concerns, any feedback on how to improve upon the video. Please, I am open to learn. And if you find the video very informative, please feel free to share it with any of your friends, family, medical professionals, even if you believe that this video provides that type of educational value. So without further ado, here it is, our healthcare system in 10 minutes. Enjoy. So for this explanation, I'm going to use a very long-winded metaphor using the Parthenon in Rome as our vehicle to describe our entire US healthcare system. So since we were small children, we have always been indoctrinated here in the US that in the event of an emergency, you call 911 or go to the nearest hospital. So since being, small children, we've always been told that the hospital is pretty much like the center of the world of healthcare, right? And most people still believe, the hospital is still the center of the world in healthcare without realizing that there is a whole map that is needed in order to maintain and run a hospital. And it's only just one part. Our system is very complicated here and there's so many moving pieces. And I hope this metaphor can go ahead and teach us how our system here works. So we're going to start off with the hospital. And for us regular, young people, a hospital is great for, if we get into a really severe accident, we can go there. But hospitals aren't necessarily taking on younger, healthy people. They're taking usually older, chronically ill patients. So how does a hospital keep filling up their beds? Well, they usually go ahead and partner with different facilities in the field, such as an LTAC, a long-term acute care facility that houses a lot of patients needing a different level of care. But sometimes these different facilities don't have the machinery or the doctors or the staffing to go ahead and handle patients who are needing a higher level of care, such as a hospital setting. But once they reach their exiting point at a hospital, but are not necessarily ready to go home yet, hospitals can go ahead and discharge to a long-term acute care facility or maybe a subacute facility. Subacute has less machines and less doctors as an LTAC, or comparatively speaking to an LTAC in hospital, but sometimes it's probably the most appropriate level of care for some folks that they don't really need machines or surgeons to be operating on them. They just need, a doctor who is doing their rounds, nursing constantly 24/7, which then leads to skilled nursing facilities. So skilled nursing facilities do have nursing 24/7. Usually patients can be transferred to a skilled nursing facility after a hospital stay if they only need, nurses to go ahead and take a look at them, make sure that their vitals are doing well, and not necessarily needing, a 24/7 doctor on site to go ahead and look after the patient. In addition to that, some other levels of care that are not quite as intense as skilled nursing, but still house a lot of patients are different facilities such as boarding care, conjugate living, recuperative care, or assisted living facilities. Now, these places do have some medical workers that can go ahead and assist a client, and they can go ahead and make a decision saying that it's probably for the best if we can go ahead and send you to the hospital if they believe that you need a higher level of care. Lastly, for younger folks that come in and need to determine if they need to go to a hospital, we typically go to like an urgent care, or we talk to our primary care physician to see if we qualify to, go to the hospital if we're not experiencing an immediate life death situation. Now, sometimes, a hospital isn't the most appropriate level of care, especially when dealing with like end of life. And that's where we put at the steps down here of our metaphorical Parthenon home health agencies and hospice care. Now, I put those at the bottom of our little Parthenon metaphor, not only because, they're returning to the planet, but sometimes from all of these different facilities, they can make the decision if, would you qualify to go back to a hospital, or are you ready to go home and have nurses and doctors go to your home so you can pass in peace. Now, this first section is called healthcare services, and that's what we're starting with. These are our healthcare services. And so if I back up a little bit, for all of this sector to work, there's a lot of moving parts, as you see out here, that need to contribute for this system to work. The Parthenon isn't just floating in air. It's standing on the ground. And from the ground comes herbs, grass, trees, flowers, or what I would like to believe, pharma. For thousands of years, we have used our planet's resources in order to create medicine to heal ourselves of ailments. And so standing on the ground of our healthcare services is pharma and the planet, our Earth. Over here in the deep blue sea are all the startups, the biotech industry, IT, AI, innovation, the new ideas that go ahead and try to feed into the system. And it's very connected to pharma. Pharma uses biotech in order to create the medication that goes into these systems in order to heal us. And this sector of healthcare is called healthcare industries. But as you can tell, there is a whole section left, right, that we haven't even spoken about. In order for us to utilize these different services and for these different industries to be coordinated with each other, we can't talk about these industries without talking about healthcare regulation. What drives and keeps this industry and the money flowing in order for all of this to work? So we look at the very big, giant red ball in the sky, which is our government. Our government created CMS, the Centers for Medicaid and Medicare Services, in order to figure out and regulate all of these industries, make the rule of law of how all of this is going to be managed and coordinated. And with that, how do we get paid? And we get paid through Medicare, Medicaid, and commercial insurances. There's also government grants for healthcare industries, as long as they're creating something that is at the benefit of progressing the future of our healthcare, they can also apply for government grants so they can be funded and regulated. And then once they go ahead and create the tech, they begin their business to business negotiations with the pharma companies, with the hospitals, with these different levels of care in order to fund their business and to go ahead and supply these different organizations with the different tools that they need in order for us US citizens to receive our level of care. Our government created an insurance based economy so that as the prices of an inflation increases, we can have insurance to go ahead and offset how expensive it is to maintain something like this. So this is where we get our healthcare services and how healthcare is managed here in the US. So when you look at the big picture, this is how all of the different industries, businesses, services are managed and regulated in the United States. And there you have it, our entire US healthcare system in 10 minutes. If you enjoyed this video, please consider liking, subscribing to my channel, sharing this content. I love what I do. I love my job. And anytime that I am available to go ahead and take these extremely complex topics and simplify them into an infographic for any of you, please, any suggestions of what in our healthcare industry you have any questions on or you want a simplified explanation of, leave it in the comments down below. I will absolutely get to work on that to provide that type of video, that type of educational value. It is my passion and I enjoy doing what I do. Other than that, I hope you have yourself an excellent day and I'll see you on the next one. Thank you so much.